Be the weird one. What does that mean? Well, it's strange to recover from persistent pain when lots of people around you, when they see you recovering, deny it even is possible. Watch this video to learn a little bit more. It seems weird when people recover from persistent pain, especially if people who they know have seen them in pain for such a long time, especially if people who they associate with have similar conditions or labels that they believe are the sole cause and meaning of the pain. I have two examples of patients who started to improve and reported it back to family and friends and other people and got strange responses. Reactions really, because the people who are making the responses, they're unconscious of those reactions. But it's easy to get sucked back in. So the first person was somebody who's had pain in the shoulder for a year. Pain in the shoulder. The circumstances, if you're interested, there's always a story. Always a story. It wasn't trauma, there was no event, no accident, no injury. And if there was, sometimes that's relevant for the first 3 months, but you get stuck in the loop after that. In this case, there was no trauma. Painful shoulder. Checked everything. There's physical signs, there's restrictions, there's muscle spasm, there's tests on nerve measurements that you can do and reactions. So you see this, it's not in somebody's head, it's in the body. It's like seeing someone blush or feel nervous or tense up. It's a physiological reaction. And he was stuck in between two people that were being disciplined at work, and he was a witness to the event, even though he didn't see it. He happened to be in the building, and so he was being got at from both sides to almost manipulate to say he'd seen or heard or could take the point of view of the opposite person. That was his workplace environment, 40 hours a week, and imagine what that does to you. And it was a serious event, a serious incident. Imagine what he was shouldering for that length of time. Imagine what he felt at night laid in bed. Imagine what he woke up with in the morning going to work, and how he had to suppress how he felt. And if he wasn't particularly good at knowing what to do, he might not have had support structures, which is sometimes people at work you can chat to and have a laugh with, that wasn't there. And at home he might have had other bits and pieces, but the balance was lost. Now, so he starts to get better. After the first session, we just explained the process, that it wasn't damage, it's linked to the event and how he's felt and how he's tried to cope with it subconsciously, and it manifests in pain. Neurochemically, biomechanically, however you want to understand it, it seemed to work for him. Pain drops, he lifts his arm up, he can't believe it. He goes home, tells his wife says, that can't be right. Can't be right. If someone explains a concept that you are absolutely unaware of, sounds like a flying pig. She said, well, if it's working, she was flexible enough to kind of let him do his thing. If he's getting better and less pain, it's an easier job for her at home with a partner, so he kind of comes to accept it. But he has a friend who'd already had failed surgery for the same diagnosis, subacromial bursitis or calcific tendinitis, whatever you want to call it. We call it all sorts of rubbish in the physio world. And this guy had an operation, surprise, surprise, didn't help, and cortisone injections didn't help, still got the pain. So this guy who's well educated in poor responses to medical treatment sees somebody who responds better than he did from being talked, having a chat with, denies it's even possible, says, no mate, you will need an operation, you'll probably need injections and operation. What, for something that doesn't even work? Unbelievable. I said to him, set some boundaries. Yes, with your wife. Yes, definitely with your partner, your mate at work, or your friend who wants you in as much pain as he's got. Probably why he keeps you close as a friend. So stop letting them even get anywhere close to it. Fortunately, I catch him soon enough after to reassure it. Maybe it's not me, maybe he's already got it, but reinforcing that sense of safety is key, and your voice has to be the strongest. So be the weird one. Be the weird one that gets better when others don't. Second one is a lady in her 70s. She's about in her 70s, I think. Hip pain for 3 or 4 years. Thought it was arthritis. Thought it was degeneration. Thought it was her age. Thought it was influenced by the weather. Thought it was the weight. Thought it was the wear and tear. Thought it was the fall down the stairs 30 years ago that's come back to haunt her. Thought. Most of those thoughts are scary, predictive, create physiological responses in the body of tension, will eventually lead to pain. Pain comes with these weather, sees the pain with the weight, sees it with the age, they become associated and conditioned responses, the loop's closed. Mixing with people who have the same conditioned responses, they've all got arthritis and they all got pain when it's cold weather. What a load of rubbish. She hasn't got any pain anymore. She's still got the arthritis, she's still the same age, she's still got wet weather outside. So her pain's gone now, she's got it, she's flexible, psychologically flexible. It isn't anybody else's fault who isn't. They may die without ever reaching that level of cognition, wisdom, experience, and it isn't their fault, that's just the way things happen. Wouldn't it be nice if you all got taught this at school? All you can do is present yourself, how you're feeling. Now if other people don't like how you're feeling, they'll tell you to not feel like the way and want you to feel like they do. So the lady described her friends as all having these kinds of pains, all having them, and they're saying, what's wrong? One of their friends in particular said, what's wrong with you? Because there's nothing wrong with you. What's wrong with you? Because there's nothing wrong with you. And it confused the lady who's in pain with all the age-related conditions or conditioned responses to see a friend who's the same age with all the same conditions but no longer has the conditioned responses. I said to her, be the weird one. I said to the guy, be the weird one. Let people say whatever they want to say. People think I'm the weird one sometimes. That's physios, that's patients. Sometimes it works, sometimes it doesn't. What you present to people. Listen, let them do whatever they do. There's a good chance that pattern of thought and reaction and behaviour will create pain. Doesn't mean that everybody else, me included, won't feel pain. We just won't suffer as long as other people. And I suppose that's all you can look after is yourself, isn't it? Be the weird one.